This is a WSFA TV News special report. Medicine in Alabama, its costs and its quality.
In the next half hour, we'll examine medical care in Alabama, its costs and its quality. Anyone who's dealt with any facet of medical care knows that costs are already high and climbing. We're going to try to tell you why. Also, we'll discuss the quality of the state's health care with several of Alabama's leading medical authorities. And we'll look ahead to health costs in the future. We hope that by the end of this program, you'll have a better understanding of a complex and often controversial aspect of our everyday lives. The state of Alabama is divided into 6 separate medical regions called Health Service Areas, or HSAs. Each has its own regional coordinator, and each is funded separately. The reasoning behind this breakdown is to provide more localized control and operation of the state's medical services. This includes hospital associations, emergency medical services, and rural health services, to name a few. On a statewide basis, there are more than 140 hospitals, both large and small, operating in Alabama. In these hospitals, there are an estimated 18,600 hospital beds, almost 3,000 more than 6 years ago. Likewise, the number of practicing physicians in the state has increased from 2,627 in 1971 to the current level of 2,836, a 21% increase. But perhaps the most dramatic increase in medical services over the past several years is in the number of active RNs. In 1971, there were less than 8,000 nurses active in the state. In 1977, there are 11,500 active RNs, an increase of 44%. As these figures indicate, the volume of medical care services in Alabama has increased significantly. According to the president of the Alabama State Hospital Association, Perry Cox, Alabama's health care is now comparable to, if not better than, any other state in the country.
I think we have one of the best medical care programs that we've ever had. I think that our ultimate goal has been to provide the best care to the citizens of our state. And over the last several years, decade, we have attempted to provide that care to the patients to whom we serve. Many increases have been made in our facilities and the services that we have to offer. And this is brought about by new technology, by the expansion of educational facilities and teaching our physicians, and in turn our own educational programs to provide that education that's necessary to provide services to those patients to whom we serve.
One area where Alabama's medical care is lacking is in its supply of nurses. For several years, there's been a shortage of practicing RNs and LPNs, so serious that some hospitals have recruited nurses from as far away as Canada. Liz Barker, Executive Director of the Alabama State Nurses Association.
Well, we know that there is a shortage of nurses. That we accept very well. We also know that health care delivery system in Alabama needs to be expanded so that every person in Alabama has access to a health system where they can receive quality care. And to provide this, we're going to not only need the nurses that we are short now, but to expand, we will need more nurses to provide primary care, especially in our rural areas.
I think we have several major problems in rural health in Alabama, and the first one that comes to mind is the problem that exists pretty widespread is the shortage of physicians, the shortage of medical manpower, actually the shortage of medical personnel in all categories. Physicians and nurses and nutritionists, we have difficulty in recruiting this kind of help for our departments.
How bad a problem is it with the doctors and the nurses?
The major problem seems to be the shortage of physicians. We are always trying to find people who can provide us with medical coverage for the programs that are done in the health departments where our nurses need medical backup, supervision of the procedures that they are doing for the patients, and a physician that they can call for advice as they are performing their services and for help if the patient should develop some kind of problems.
What are some of the primary differences between, say, a rural health care situation and the same type situation in an urban setting?
The urban patient has a wider variety of services available because there are more kinds of agencies that will help. This is balanced, I think, a little bit, though, by the fact that in the rural areas, the agencies are aware of the need to close the gaps, and so the agency people tend to work fairly well with each other. They know each other. When you get into a small area, the public health nurses know the workers in the Department of Pensions and Security and the mental health people. They tend to know each other and work together with the families who have problems. The workers in the health department and in all of the social agencies in the rural areas get to know the families better also, and this helps a great deal in helping the families to solve their problems. The fact that the nurses know how these people think, they know the people, they know their backgrounds over many years. People are families that have been in the counties for a long time. The nurses very often have been in the counties for a long time, and this makes for a more complete range of services, really, because the nurse not only knows the families but knows what other agencies she can draw on to help the families get what they need.
So far, we've focused our attention on medical care in the hospital situation. However, an important aspect of health care not to be overlooked is emergency care. There are 584 ambulances in Alabama, with all but 80 of them licensed to and regulated by the state. The others belong to Alabama Society of Rescue Squads and are used primarily in rural areas. Although they don't have to conform to rigid state regulations, Art Harmon of the State Department of Emergency Medical Services says most of the ambulances do meet most of the requirements. Harmon says it's because of these factors that emergency medical services in Alabama rank among the top in the nation.
And in my position, I'm able to see my counterparts and make comparisons, and I think we're ahead of many states, and particularly many of the rural states in Alabama. So I think generally it's good. I think the strength lies in the manpower that we have. We have we have about 5,000 licensed emergency medical service technicians, basic technicians operating in the state of Alabama. We have about 350 EMT intermediates, and we have 435 EMT paramedics. The differences between them, really the essential differences lie in differences in their training, the levels of their training, and also their capabilities and what the state law will permit them to do under terms of medical accountability. The EMT basic renders basic life support, stops the bleeding, treats for shock, helps delivers a baby under emergency conditions, certain very basic functions. And the intermediate EMT has more training, and he can defibrillate a patient, he can start intubation, endotracheal and esophageal intubation of patients. He can start the IV fluids. And then the paramedic, who has more training than the intermediate, he can do everything that the basic can do. He can do everything the intermediate can do. In addition to that, he can inject medication. He can provide medication upon the orders of the physician, and he must be in direct communications, in direct contact with an online physician 24 hours a day when he's operating in the field. Part of our strength lies on a good sound communication system, and we're developing this. Some areas it's stronger than others, where we have good communications with our field paramedical personnel, emergency medical technicians and the intermediates, and the physicians that they work with in the hospitals.
One major problem Alabamians face with medical care is its cost. But what few persons realize is that Alabama ranks near the top for low medical costs. For example, the Alabama Hospital Association estimates the average cost per medical case in the state to be near $820. That may sound high until you consider the national average is about $1,100 per medical case.
Hospital cost today is the best bargain in America. The fact that people speak of cost and the high cost in hospitals is basically because they're buying something that they don't want to start with. But we talk about the escalation and we talk about why the cost does increase. We have to think about the cost of the other items that we have in our grasp. And I'm speaking of food cost. We think of a few years ago that a quart of mayonnaise cost 19 cents. Today it costs $1.25, say. And what has coffee done to us? Coffee, I can recall, and this is quite a few years ago, that 3 pounds of coffee was 39 cents. Today coffee is $3.50 and $4 a pound. So when we talk about cost and the increase in cost, we talk about something that's relative. Hospital cost is maybe relatively increased to those other cost increases. That's not to say that inflation itself hasn't had a great deal to do with why cost has increased.
Another factor which contributes substantially to the cost of the state's health care is Medicaid. An important fact to consider here is that while 10.7% of the nation's population is below the poverty level, almost twice that figure, 20.7% of Alabamians, make less than the poverty level income. So for these people, the only way to receive medical care is through the federal and state-funded Medicaid programs. The Medicaid Commissioner for the state of Alabama is Jack Worthington.
I don't feel that Medicaid causes any unusual circumstances to occur in the health field. We simply place a bigger demand on the resources in the health area. But as far as Medicaid and the general health area, I think we work hand in hand in utilizing the services that are available for a particular category of people. While there are other programs that provide health services for other categories of people, Medicaid is only involved in the aged, the blind, the disabled, and the dependent children categories. So we feel like we don't cause any unusual problems. We cause a greater demand, and that's all. You know, the legislature appropriates all state dollars that are available for services of all agencies in Alabama. The pressure is on the legislature to prioritize the dollar amounts of their appropriations. While we feel that Medicaid is an extremely high priority, there are many other high priorities in the state government too, and we all compete for the same dollars. There simply aren't enough dollars to go around. So the politics of Medicaid, as I see it, is the selling of the Medicaid program as an extremely high priority to the legislatures that make appropriations for the state of Alabama.
Senator Burt Bank of Tuscaloosa is chairman of the Senate Health Committee, which serves as a legislative watchdog over health care industries in Alabama.
I go to the legislature on a health care proposition. It's not going to be the priority of all the legislators. They have other priorities to them equally as important. So politics plays a big part in getting appropriations. Health care is costing a lot for one reason. Very little money is spent on preventive illness. 1% of the total cost is spent on preventive illness. Therefore, we're not preventing it before it gets to a serious stage. Another reason for the soaring cost of health care is that the health providers have been in so much litigation, malpractice suits, that they've got to be careful. Today, when you go to a doctor, he will keep you probably 3 times as longer than he normally did because of the malpractice litigation. In other words, he wants to check everything to avoid any malpractice insurance. I've had hospital people tell me that now when a person comes into a hospital, they feel that maybe he or she may be perfectly well, but they've got to go to the extreme. They've got to examine that patient before they release them. Now, this is one thing that's causing high cost of health care, and this is what's bringing national health insurance. It's coming, and now it's going to bankrupt a lot of states. We're going to be in a similar position that Medicaid's in, because national health insurance, once it's passed, is that they're going to come into Alabama and say, we'll give you X number of dollars, and you'll have to put up 25% or 40% or 50% in order that everyone can be assured of good quality health care. That's one of the main reasons, in my opinion, of health. Health providers have got to be careful. Now, national health insurance, at the present time, I can't give you really my opinion because I don't know what it's going to cost the state. I'll tell you this. If it's going to cost the state what Medicaid's costing the state of Alabama, the legislature's going to have to give lots of consideration because Medicaid is about to bankrupt us now.
We feel like the Medicaid problems that we see today are both short-run and long-run problems. If we completely omit looking at the long run, we'll have crisis after crisis each year. So we're laying the groundwork this year for the next 5 to 6 years of looking at areas that we need to work in the Medicaid area.
There are 350,000 recipients of Medicaid in Alabama. There are approximately 15,000 people in Alabama in nursing homes who are Medicaid recipients. We've got some fraud in the Medicaid program. There's one dentist that I'm familiar with that's being indicted. We've had some doctors that have been compelled to discontinue the program. Some hospital and nursing home people have been involved. I would say this, of the 2,300 doctors that are participating in Medicaid in Alabama today, I believe we've got less fraud in any state in the nation, and I've been to Washington, talked to HEW people about the problem existing. Now, Medicaid is just expensive. First place, we've got some fraud in nursing home recipients. Let me give you a good example. The Medicaid, if you make in excess of $356 a month, you can't become a Medicaid recipient in a nursing home. So what they're doing, let's assume that a nursing home recipient has got $386 a month, got a $30 income from a rental. Well, they'll transfer that $30 a month to their friend or other members of the family, and all they can stay under Medicaid. Well, this is certainly fraud. The cost of health care is just terribly high today. In Alabama, we're going to need in the neighborhood of $65 million this next fiscal year. I think we appropriated $50.2 million last year. You're getting the basic cause, in my opinion, of Medicaid is that the welfare program needs to be revised. As you know, the Pension Security Department gives the eligibility list to Worthington's office, and that's the list he takes and administers the Medicaid program. I believe those states that are doing an excellent job today have one agency handling the Medicaid program instead of two agencies. In addition to that, the states that are doing a good job are evaluating the welfare program. They are taking off recipients of Medicaid who shouldn't be on the list. And I hope that the Pension Security Department today is giving thousands and thousands of minutes of consideration, because this is important. The welfare program needs revising. We've got people who are receiving Medicaid that shouldn't be there. And as a result, the Medicaid recipient list is growing instead of diminishing. This is the basic problem, in my opinion.
The projections that are made by Medicaid, we feel, are fairly accurate. The major project that we're involved with now, Dave, is looking at cost containment and cost reductions in Medicaid, so that we can do some things that will contain costs without going back to the governor or to the legislature asking for additional dollars. This is the primary thrust that we're most interested in right now. We have good health care systems in Medicaid, but they haven't been as efficient as we would like to see those programs operated. So during the current year, we feel like that we have identified sufficient cost containment measures to save the Medicaid program some $8.5 million for this particular fiscal year. If we project that throughout next fiscal year, we think that Medicaid will have a savings of some $15 million for next year, just through the cost containment measures that we have implemented thus far in Medicaid.
There's any number of new types of equipment, new types of procedures. The physicians are studying more in depth to some of the subspecialties of medicine that, as I see in the future, that we'll have even a lower mortality in a lot of these areas. The statistics are available that would indicate the reduction in deaths that we have had for infant mortality over the last several years. Things that are people more familiar with is polio and the reduction of that. It's many illnesses have the mortality has reduced tremendously, and as we see in the future that this will continue.
But we are working on increasing the number of programs available to the nurses and to the quality of the programs that are presented. But also nursing is expanding in the areas that they are providing care. Nurses used to provide care mainly in the hospitals, and now we have nurses working, only about 50% of them work in the hospitals. Others work in public health and the schools, and we have a rural health clinics which are opening and providing primary care throughout the state, and that's one of our thrusts that we think is so important.
The securing of professional personnel to staff our hospital. You know, we have some of the finest educational programs anywhere in the world right here in the state of Alabama. We have a large number of physicians that are trained in Alabama to do their residency programs and to finish their specialties. We have excellent facilities for the training of nurses, for the technicians, for the laboratory, for the radiology technology, for respiratory therapy. The educational programs we have are unsurpassed. The difficulty that we have is oftentimes is the fact that people are not quite as prone to go to some areas as they are to others. But to follow up with that and to say that right here in Montgomery, I expect that there's quite a shortage of personnel, qualified personnel, as well as it is throughout the state. Now, a lot of that goes back to the fact that the people we have in the healthcare field are some of the best dedicated people in the world. This is what makes the hospitals. This is what these are the people that provide the care. They're great.
It's a constant reading.
One of the difficulties that we have is the fact that we do operate 24 hours a day, 7 days a week. And many people that are interested in the healthcare field are not interested in that type of program. But there's a great satisfaction with the people. They are the best in the world. And this is the reputation that the hospitals have, is based on those employees that we have and the dedication that they have in treating patients. And we're proud of the employees in our hospitals. We have a wonderful relationship with the people, to the patients, to taking care. The joy of winning and the agony of a defeat.
In conclusion, it appears that most, if not all, of the problems surrounding health care in Alabama stem from one factor: money. Medical care costs are continuing to increase faster than the average person's income, and even faster than the legislature can appropriate needed funds. So apparently, the primary solution would be self-regulation and a strong cost containment program by the medical care industry itself. And here in Alabama, the wheels are already turning in that direction. I'm Bob Howell reporting.
This has been a WSFA TV News special report. Medicine in Alabama, its cost and its quality. A presentation of WSFA TV News. This program was pre-recorded for presentation at this time.